Hemifacial spasm is a condition where the nerve that allows us to move our face undergoes changes because of a compression of an artery. This usually can start subtly, where there's twitching around the eye, but it can progress to become very significant, where the entire face may be pulling, making it hard for patients to function, where they can't read, they can't drive, they can't go about their day functioning with their whole face twitching. This is usually happening because one of the arteries in the brain is starting to push on the facial nerve. The nerve is constantly trying to repair itself. However, it never gets to fully repair itself because that artery never stops pushing on it and the heart never stops beating. Once we separate that artery from the nerve is able to repair itself and the twitching goes away. So the treatment for it is essentially to separate that artery from the nerve. And there are different ways to achieve that. Sometimes there's a smaller artery, and that can be performed with just simply pushing these little cushions there of Teflon, and that's extremely effective. But sometimes they can be very large arteries that are pushing on it. In that instance, we would have to use something a little bit more complicated, what we call a sling, where we create almost like a little lasso to hold that artery away from the nerve. We secure that lasso on the bone. So that becomes a little bit more complex, but it's also extraordinarily effective. UPMC has the prototypical cranial nerve program. Everything was born here, essentially. So we have one of the longest histories in treating this disease. That, combined with our expertise in skull-base surgery, allows us to actually visualize these areas in a much more efficient manner. All of this can be done through, again, a minimally invasive surgery through about an inch incision. Patients will be admitted to the floor and go home the next day. We are a center, we can provide everything.